Moments with Dr. Greta are brought to you by the Ashley Clinic in Chanute, Kansas. Measles. Know what to expect for your child and protection. First of all, it is marching across southwest Kansas and it's getting closer. If you go to CDC website and KDH&E and put in Outbreak and Measles, you can see a map of where it's coming. And why is that important? Well, they are recommending measles vaccine for people who are in bordering counties. So in other words, a county's got some cases. Well, they already are a done deal and they are going to be getting a vaccine. But it's the bordering ones that now are being pushed into getting other vaccines, which are a very, very important thing. And why is that? Well, because measles takes a very long time to show up. From the time you are exposed, it's 8 days before you even start to have a little bit of contagion and 10 days before you start having the runny nose and it looks just like allergies or a little bit of a cold. 12 days you have the spots in your mouth called Koplik spots, and 14 days you start having that rash. Now, you have been contagious for at least 4 days before that mouth thing, and you were probably still feeling fine, but you were spewing forth. And then you are contagious 4 days after the rash starts, but you are miserable for up to at least 22 days or longer. This is what makes it so bad for our little kids. If they are around someone who has measles and they are not protected with the shot, then they are at a high risk of serious illness and even death. So pay attention, ask your doctor whether or not your child can get their vaccine earlier. And if you don't want to vaccinate your kids, maybe you just stay away. You just keep everybody isolated and quarantine. Quarantine for non-vaccinated in some of the things I saw was at least 21 days. So be sure that you are safe and give your kid a hug.